This is a topic that has always fascinated me. I love medical history. And what I want to talk about is gunshot wounds in the 4 American presidents who have been assassinated. Abraham Lincoln was 56 years old in 1865. Past medical history significant for recurrent malaria, smallpox, frostbitten feet, lifelong constipation, scarlet fever, and severe bouts of depression. For many years, he was thought to suffer from Marfan syndrome, but genetic testing on first-degree relatives has shown that Lincoln probably did not have Marfan syndrome. Now the latest thinking is he might have suffered from one of the multiple endocrine neoplasias. And several contemporary doctors are actually surprised that he lived as long as he did. By age 17, he'd reached his adult height of 6 feet 4 inches, but he was a skinny dude. His weight varied from 160 to 180 pounds. His contemporaries described his spider-like legs, sunken breast, an intermittent squint of the left eye, which might make you think about Marfan's with the lens dislocation. But again, he was not shown to suffer from Marfan's. April 14th, 1865, Good Friday, Lincoln attended a play at Washington's Ford Theater at the insistence of his wife, Mary Todd Lincoln. 5 days earlier, General Robert E. Lee had surrendered the Army of Northern Virginia at Appomattox. For all intents and purposes, this ended the hostilities between the North and South, although remember, this was just the Army of Northern Virginia. There were other armies still on the battlefield, and in fact, on this day, Lincoln kept going to the War Office to catch up on the words of, or on the conditions of surrender from Joseph Johnston, who was negotiating with Sherman in the Carolinas. There was no telegraph at the White House, but there was at the War Department, so there were couriers who would bring messages back and forth. Despite 2 trips to the War Department looking for telegrams about the settling of these 2 armies, he had not gotten any more information. And earlier in the day, he had met his vice president, Andrew Johnson, for the first time since they had been inaugurated together back on May 4th, about 6 weeks earlier. Remember, this is the day when the inauguration was May 4th. It was only changed to January 20th during the the Franklin Roosevelt administration. Now, General Ulysses S. Grant was the hero of the Union, and he had actually planned to accompany the Lincolns to the theater that night. But he begged off at the last minute. He said that he wanted to visit his children in New York City. The reality was that Grant's wife, Julia Dent, detested Mary Lincoln, and the 2 women were actually jealous of each other. Mary Lincoln was a little crazy anyway, and she was always under the impression that other women were trying to steal Abe from her. And somehow Julia Dent Grant had come under her purview as somebody who was trying to steal Abe from her. Now, you're the President of the United States, you want to go to the theater, and you start asking other people to go to the theater with you. And this is what Lincoln did with all of the visitors that day, and everybody begged off. The Postmaster General begged off. Even his son, Robert Todd Lincoln, who was fresh from the battlefield, he had had a very cush job with Grant down at City Point. And he said he was too tired, he wanted to sleep. So finally, they were able to make contact with one of Mary Lincoln's friends, Clara Harris. Clara Harris is the daughter of Senator Harris from New York. Major Henry Rathbone is her fiancé and also her stepbrother. They were going to see the production at Ford's Theater, one of 2 theaters in Washington at that time. The Lincoln children were actually at another theater that night. This starred the popular Miss Laura Keene. Just after the second introduction at about 10 p.m., a 27-year-old actor, John Wilkes Booth, entered the theater for the second time that day. He had had his mail delivered to the Ford's Theater while he was a rather itinerant actor. His older brother and his father were far better known than he was. He was just trying to make his own name in the theater. He was one of the more well-known actors in the United States at the time. He actually decided to carry out this assassination, which he had been planning for many, many months. This is the way the stage was set. The presidential box is over here, And you can see the Treasury flags are hanging from it. And they will come into play shortly. It's, as you can see, it's not a very good place from which to watch a play, but it's an excellent place from which to be seen. And that's sort of what the presidential box was all about. Booth had drilled a peephole in the door of the presidential box, and he blockaded another door to prevent people from coming up. At 10:15, he quietly entered the box, and he shot Lincoln in the back of the head with a small Derringer pistol. The handgun was about 6 inches long. It fired a ball a half inch in diameter, so more than .44 caliber. It was a 2.5-inch barrel, and the distance was about 2 feet, essentially point blank. The victim slumped forward in his chair. Major Rathbone leapt from his seat, and he moved towards the intruder, who slashed at him with a 7-inch knife blade. And Rathbone actually ended up with a large laceration in his arm. The knife, the pistol and the knife are both on display at a museum in the basement of Ford's Theater in Washington, D.C. Now, Booth dramatically leapt to the stage about 12 feet below. He was a very athletic actor, and he actually specialized in roles that required him to leap from a great height. I don't know of that many roles these days, but this is what he specialized in. That was very confusing. When he landed, his horse was in the alley. He had his spurs on, and the spurs caught in the flag. Now, you don't see the flag in this picture. That's important because the flag was there, and that's what tripped up Booth. So when he landed on the stage, he twisted his ankle, and he had a Pott's fracture, a distal fibula fracture. Well, this is before the days of the Ottawa ankle rule, so he ignored that. He limped across the stage. He was brandishing his weapon, shouting Sic Semper Tyrannis. Now, the audience at first was a little confused. They started looking at their program saying, is Booth in this play? And the actors on the stage all recognized him right away, what Booth was doing there. And it took a few seconds until Mary Todd Lincoln and Rathbone up in the presidential box started screaming for people to realize what had happened. By then, Booth had made his way all the way across the stage and was heading out the back door where his horse was waiting. Sorry, this is a little, I went on an assassination vacation a couple of years ago and visited Ford's Theater and got some pictures. And the back alley now is just a brick wall, but you bet I visited that back alley so I could see where Booth got on his horse and rode away. There was a physician in the audience that night, Charles Augustus Leal, a military physician, a young guy. He was only 23 years old, but he was assigned to the theater that night because of the presence of the president, and they thought Grant was initially scheduled to go to this play. Now, Leal made his way to Lincoln in the box, found him sitting upright in his rocking chair, and when he first felt a pulse, he felt nothing. He also noticed that the victim had what we now call Cheyne-Stokes respirations, even though that wasn't described until about 20 years later. He placed Lincoln recumbent on the floor, lifted the eyelids, and saw that one of the pupils was already dilated. Feeling the back of the head with his hands, he discovered the wound and digitally removed some clot and allowed blood to flow freely. He said immediately when the blood started to flow freely, he could feel a pulse. It almost sounds like a Cushing response, although it would have happened incredibly quickly. And it wasn't described for Cushing for another 40 years or so. But that's sort of what this sounded like. By this time, another doctor who was in the audience had made his way up to the booth. And then what Leal did next, I think, is absolutely remarkable. This is his own account. He says, I knelt on the floor with a knee on each side of the pelvis and facing him. I leaned forward and opened his mouth and introduced two extended fingers of my right hand as far back as possible, and by pressing on the base of the paralyzed tongue downward and outward, opened his larynx. So he's clearing the airway. This is 1865. He says, I also, with my right hand, by intermittent sliding pressure under and beneath the ribs, stimulated the apex of the heart. He's doing chest compressions in 1865. I leaned forcibly forward, directly over his body, thorax to thorax, face to face, and several times drew in a long breath then forcibly breathed directly into his mouth and nostrils. Mouth to mouth, 1865. These were later rediscovered, I would have to say, in the 1940s and 1950s. The classic Copenhagen article about CPR was in JAMA in 1960. So it took 95 years for people to regain these same skills that Charles Leal was using in resuscitating the president in 1865. He did manage to resuscitate him, and at that time the theater was not considered a proper place, and especially a proper place for the President of the United States to die. So several soldiers took the body, and they went out into the street, and across the street was Peterson's boarding house. And somebody was standing on the porch and said, "Bring him in here." So they brought him into Peterson's boarding house, into the front bedroom, where they stretched him diagonally across the bed, because the bed was only about 5'8", and he was 6'4". So they had to put him diagonally. And then they undressed him to make sure they weren't missing any other wounds. The jacket had been specifically made for Lincoln by a relatively new company in New York called Brooks Brothers. And there's actually a Brooks Brothers label on the inside of this jacket. These were the contents of Lincoln's pockets. You will notice the only paper money he was carrying was a Confederate $5 bill. Now, in the meantime, the family doctor, Robert King Stone, was summoned, as was the Surgeon General, Joseph Barnes. He assumed care of the president along with Dr. Taft's, and the family doc, and Taft's account was published in the Philadelphia Medical and Surgical Reporter on April 22nd, 1865, less than 2 weeks after this happened. He said the wound was examined, the finger used as a probe, and the ball was found to have passed beyond the reach of the finger into the brain. Somebody took an unwashed, ungloved finger and stuck it in the president's brain to try to find out where this bullet had gone. The respiration became labored, pulse 44 and feeble, eyes entirely closed, the left pupil much contracted, the right widely dilated. So you're starting to see signs of increased intracranial pressure and coning out. At 11:30 p.m., twitching of the muscles on the left side of the face, the mouth was drawn to the same side. At 1 a.m., there were spasmodic contractions of muscles, pronation of both forearms, and the pupils widely dilated. So you're just following this head injury through the progression. It was remarkable to observe the great difference in the character of the pulse whenever the orifice of the wound was freed from coagulum and discharged freely. Again, describing a Cushing response. Removing that little bit of blockage, decreasing the intracranial pressure, and suddenly the heartbeat comes back. Taft then describes wound exploration with two different probes, one of which was passed more than 5 inches along the bullet path until it struck fragments of the orbital plates. So they shoved it all the way through to the front, trying to find the bullet. After cessation of bleeding from the wound, the respiration was stertorous up to the last breath, which was drawn at 21 minutes and 55 seconds past 7. The heart did not cease to beat until 22 minutes and 10 seconds past 7. So he lasted several hours after what was an incredibly lethal bullet wound to the back of the head at point blank. This is a bad representation of Peterson's boarding house, although that hideous pink wallpaper is still there if you've visited that. This is a plaque that's out front. The bed is on display. This is where Lincoln was taken for the postmortem. This is now what is called the Lincoln Room in the White House. It's called the Lincoln Room not because the Lincolns lived there, but because that's where the postmortem was done on Lincoln. And it's still considered a great political coup to be able to stay in the Lincoln Room. But apparently there are ghosts there. Dr. Stone obtained permission for autopsy, and at about noon, the postmortem was made in the guest bedroom by Assistant Surgeon General J.J. Woodward and Edward Curtis. Their official report gave the track followed by the lethal ball. The ball entered the skull through the occipital bone about 1 inch to the left of the median and just above the left lateral sinus. It then penetrated the dura, passed through the left posterior lobe of the cerebrum, entered the left lateral ventricle, and lodged in the white matter of the brain just above the anterior portion of the left corpus striatum, where it was found. The ventricles were full of clotted blood, and a thick clot beneath the dura coated the right cerebral lobe. So he had large subdural hematoma in addition to intracerebral bleeding. Now, just as 98 years later there would be controversy over another presidential autopsy, many discrepancies exist in this autopsy. The primary pathologist, Woodward, said the bullet lodged in the left side of the brain. But 2 other doctors present said no, it was on the right side of the brain. There was also disagreement between Taft and Leal about which pupil was constricted and which pupil was dilated before both pupils became dilated. Does it really make any difference? Probably not. This, I think, was a lethal wound no matter what. Artifacts from the autopsy are currently housed at the Medical Museum of the Armed Forces Institute of Pathology, which is out behind Walter Reed Hospital in Washington, D.C. It used to be on the mall up until the 60s. The first time I visited that museum was in 67, and it was still on the mall. But for some reason, they moved it way out of the center of town behind Walter Reed Hospital, and it's probably the best medical pathology museum in the United States. And this is from a guy who lives in Philadelphia and is within walking distance of the Mutter. And the Mutter is the second best, I will admit that. But I've got to give props to the Armed Forces Pathology Museum in Washington, D.C. Could Lincoln have been saved using modern neurosurgical techniques, blood transfusions, antimicrobial therapy? Well, there was actually an article in American Heritage about 10 years ago by a neurosurgeon who said, I could have saved Lincoln. I'm not so sure. I'm really not. Although if you look at the wounds suffered by Brady, by Reagan's press secretary, it was essentially the same wound. It crossed the midline and the bullet ended up in front. So I guess that is always a slight possibility. But at that time, no. This was not a survivable wound. Everybody who was present said that, quote, most patients would have died in 2 hours from the reception of such an injury. And this is probably the best illustration you'll see of where the bullet went, how it came in and how it ended up. President James Abrams Garfield, age 49, had a past medical history of near drowning and malaria as a teenager. He was a well-educated religious man who'd been a school teacher, and he could entertain his friends by simultaneously writing Greek with his right hand and Latin with his left hand. He was an elected commander of his Ohio Volunteer Regiment during the Civil War and ran for Congress in 1862 while he was still on active duty as a major general, 32-year-old major general. He defeated the Democratic candidate war hero Winfield Scott Hancock in the 1880 elections, and he beat Hancock by fewer than 9,500 votes of more than 9 million that were cast at that time. Hancock is buried not far from me. Hancock was from Norristown, Pennsylvania, and that's where he is buried. Garfield had ties to no one, so he had actually made very few enemies except for one crazy lawyer named Charles Guiteau. Now, Guiteau had wanted to be named Consul General to Paris. Not a bad job. The problem is he had absolutely no political skills and he had done nothing to earn the job, but somehow he thought that it was his divine right to have this position. He started stalking Garfield several months before he actually shot him. And a couple of times he had him within sights, but Garfield's wife was with him. And Guiteau did not want to assassinate the president while his wife was standing by, so he held off. He also borrowed $15 from his cousin, and he bought a handgun, a .44 caliber British revolver that had a white bone handle. Now, $15 was a lot for a weapon in 1880. Or 1881. You could have bought a pistol on the street for $2, much like today. You could have bought a pistol for $2 on the street. But when he was later queried and said, "Why did you spend so much for the gun?" He says, "I wanted one that would look good in a museum." And the ironic thing is, this is the one weapon that can't be accounted for. The weapons that shot Lincoln and McKinley and Kennedy are all accounted for. But this weapon has somewhere disappeared. July 2nd, 1881, the president was going to his college reunion in Massachusetts, and his Secretary of State, Blaine, accompanied him to the train station. Garfield had only been in office about 4 months. His wife, Lucretia, was in Elberon, New Jersey, recovering from a near-fatal case of malaria. You notice how malaria was so prevalent in the 19th century. It was built on a swamp. Washington was built on a swamp. And of course there was malaria. Now, coincidentally and unknown to one another, you know who else was at Union Station? Robert Todd Lincoln. Robert Todd Lincoln was Secretary of War. The name Lincoln still had a lot of cash with the Republican Party. So Robert Todd Lincoln, let's face it, he coasted on his name. He later became president of the Pennsylvania Railroad, which if his name was Bob Smith, probably would never have happened. But and he's buried at Arlington. Robert Todd Lincoln is buried at Arlington, just down the hill from the Lee Mansion. As Garfield and Blaine walked through the ladies' waiting room at the train station, Guiteau discharged his pistol from a distance of about 6 feet. The first shot penetrated Garfield's coat sleeve, grazed his left arm. As the president turned to his left, the second shot struck him about 7.5 centimeters to the right of the midline in the 10th intercostal space. He sank to his knees and was raised upright, but almost immediately vomited. Within 5 minutes of the shooting, Dr. Smith Townsend, the District of Columbia's health officer, arrived with other physicians. They found Garfield lying on the floor of the depot in shock, so they stimulated him with aromatic spirits of ammonia and a half ounce of brandy. Dr. D.W. Bliss, a personal friend of the Garfields, was summoned and did the initial exam. I've been reading about D.W. Bliss for years. I've followed this for years. Only last year did I find out what the D stood for. Doctor. His name was Dr. Bliss. So he found the patient with extremely pale and sweaty, with a rapid, weak pulse, but he was conscious, and he complained bitterly of pain, numbness, and weakness in his legs. So Bliss did what all good doctors did at that time. He stuck his finger in the wound. He didn't wash his hands, didn't have gloves. He stuck his finger in the wound. He probably poked a hole in the liver when he did it. It's unclear exactly what happened. But he declared that the patient was to be transported immediately to the White House. Not to a hospital, but to the White House. So several mattresses were yanked from a nearby Pullman car, and they had a makeshift horse-drawn ambulance assembled. This police horse-drawn ambulance delivered its cargo to the White House at 10:45 a.m. 8 milligrams of morphine was given hypodermically, and the patient was critical but stable for the next several hours. At 3 p.m., there was a relapse into shock, and the consultants feared internal hemorrhage, but by 4:30, the worst had passed, and he rested comfortably through the night. Now, Sunday, July 3rd, passed rather quietly as renowned consultants were called to Washington, D.C. This is only 5 years after Alexander Graham Bell had introduced the telephone at the Philadelphia Exposition in 1876, and yet there were enough telephones on the East Coast that many of these consultants were reached by phone rather than by telegraph. Dr. Bliss maintained his position in charge, but there was also Dr. Frank Hamilton, Dr. Rayburn, Surgeon General Joseph Barnes, 16 years later, is still Surgeon General. Assistant Surgeon General J.J. Woodward, 16 years later, is still Assistant Surgeon General. We certainly don't see that now, do we? They come and go with every administration, and yet these guys held their positions for a long time. Barnes was actually a political appointment. He got the job because he was Stanton's family doctor. The Surgeon General before that was Letterman, and Letterman was phenomenal, but Letterman made too many political enemies and got enough. I'm sorry. And then this guy, David Hayes Agnew, from the University of Pennsylvania. And this is one of Eakin's most famous paintings. the Agnew Clinic. So they all gathered around the bedside in Washington, D.C., and they took turns poking their fingers in the hole in the side of the president without washing their hands. They decided that the tympanitic abdomen, which was initially thought to be peritoneal, was probably due to the 15 milligrams of morphine that was being given hypodermically every couple of hours. So they lowered the morphine dose, and the belly got better. And you heard the talk this morning on narcotic bowel. You know, if they had methyl naltrexone back then, maybe they could have made things go a little more quickly. But by 7:50, his temperature was 101.9. He was given some chicken broth and kept it down. And they just followed him for the next couple of weeks. Remember, this is before there was analgesics. There was general anesthesia, and there was morphine, but there were no antibiotics. There was very crude imaging, and I'm going to show you one of the imaging things in a couple of minutes. It was a very hot summer in Washington, and the fear of malaria drove them to give him doses of quinine. One of the few medicines they actually had at that time that worked was quinine. This is sort of the 1881 version of CNN. There would be large posters outside of the newspaper offices keeping people updated on the progress of the president as he recovered. I mentioned the malaria. I mentioned Alexander Graham Bell, but remember at this time that the standard of care was to localize the site of the bullet. And Alexander Graham Bell said, you know, I think I've got just the thing for you. So he shows up at the White House with his brand new invention. And who are any ultrasonographers in the group? You're going to love this next picture. This is 1881. Don't you love it? It's like a FAST exam. Except this was a metal detector, and it was to help localize the bullet. And it was sound rather than visual. He was actually listening for the sound. Because Alexander Graham Bell was a sound person. He wasn't a visual person. But I love the fact that this looks like a FAST exam. And this was totally unsuccessful, by the way. And you know why it was unsuccessful? It's obvious in retrospect why it didn't work. It worked great in the lab. What's that? Well, it's a lead bullet, but you could still pick up the sound from the reflected waves, except that the Garfields had been recipients of one of the newer advances in home comfort, the box spring bed. So he was on this metal spring bed, and it totally threw Alexander Graham Bell's invention off. If they'd taken him off the bed and put him on the floor, they probably could have localized the bullet. But then they would have done other crazy things. Then they would have stuck other things in there other than their fingers. And Bell actually got this thing patented that year. Now, throughout the summer, it was incredibly hot. They got a mining engineer to come in and hook up a very crude air conditioner, which essentially consisted of putting wet sheets in the hallway and 5 tons of ice in the basement of the White House. And they were able to keep the president's bedroom at a relatively cool 81 degrees, which for Washington, D.C. in July and August is not bad at all. It's really not. But eventually, Garfield was deteriorating. It's now 9 weeks after the shot. Garfield says, enough, I need some fresh air. I need to get to the shore. So his doctors agreed he could be taken to the shore. And when you're president of the United States, and you're injured, not only do they carry you to the train, they lay tracks in front of your summer home in Elberon, New Jersey. And they actually laid a spur of railroad tracks out to his summer home. And once he got there, he actually seemed to improve. The fresh air really did make him feel better for a couple of days, but then he started to decline again. And on September 17th, there was another rigor with chills and fever, and now Garfield had the premonition that he wasn't going to make it. On the morning of September 19th, his temperature was 108.8 degrees. And at 10:35 p.m., Dr. Bliss raised his ear from the patient's chest and said, "It is over." It had taken him 10 weeks from the time he was shot to the time that he died. At the time of his death, Garfield's frame had shrunk from 220 pounds to 125 pounds. He'd lost 95 pounds in 10 weeks. Doctors Bliss, Barnes, Woodward, and Rayburn performed autopsy in New Jersey the next day. Barnes and Woodward thus performed 2 presidential autopsies, and Woodward actually was the primary doctor who did the autopsy on John Wilkes Booth, but you probably never heard his name before. Because of its low velocity, the bullet was deflected downward from the 11th rib and smashed through the body of the first lumbar vertebra, but it spared the spinal cord. It then grazed the splenic artery and buried itself under the peritoneum. So the patient did have a pseudoaneurysm of the splenic artery. There was a rumor going around that it was a mycotic aneurysm, and the reason he spiked a fever at the end was he was dying of tertiary syphilis. But I think that's been disproven. I think the sepsis was because of all the fingers that were poked in his side. Now, very interestingly, there was no visceral injury, no spinal cord involvement, but inadvertently proving Koch's postulate several years before Koch actually did the studies. Dr. Bliss accidentally cut himself during the autopsy. Within a week, he was dead of overwhelming sepsis. This is from the Armed Forces Institute of Pathology Museum in Washington, D.C. It's kept in a shoebox. It's not on display. It's in a Tom McCann shoebox back in storage. And the reason I know that is I've actually held this in my hands. I had to get special permission to have somebody take me back. You know the scene in Raiders of the Lost Ark where they're taking the Ark of the Covenant at the end into the warehouse, and it's just row after row after row going up to the ceiling? That's what they have at the Armed Forces Institute of Pathology. But when I got back into the storage area, one of the people walked me up to a shelf, and he said, "Here it is," and he took a shoebox off and opened it and handed me Garfield's spine. It was really cool. But it's not on display. Now, could Garfield have survived today? Of course. Of course. This was far from a lethal wound. Joseph Lister's theories of antisepsis had been touted since 1855. There were still skeptics in 1881. They didn't believe the germ theory 25 years later. So they were sticking their dirty fingers into the wound. There is no doubt that had Garfield been privileged to radiography, antibiotics, ultrasound, intravenous fluids, transfusions, and other specialized care, he would have survived. And it's possible, although unlikely, that he might not have even undergone exploratory surgery. I think the exploratory surgery would have happened now, just to figure out what's going on, especially when he went into shock the first time. His wounds were far less grave than those suffered by Ronald Reagan 100 years later. After Garfield's death, there was heated debate in the medical literature about his care, and numerous involved physicians felt that malpractice had been committed. No charges were ever brought. When Guiteau was testifying for himself, he was a lawyer, so he refused legal counsel. He testified for himself at his trial, where he was found guilty, and he was hanged several months later. But after his opening remarks, he said, "All I did was shoot him. His doctors killed him." And he was right. He was absolutely right. The doctors did kill him. So these doctors who had cared for him submitted a bill to Congress for $90,000 in 1881. $90,000. You'll be pleased to know they were downcoded, and begrudgingly they were given $10,000. But yeah, if they just left him alone. The fact is, Garfield was a victim of VIP syndrome. He probably did get the best care that was available at the time, but he was definitely a victim of VIP syndrome. Now, I'm going to go through McKinley quickly because I know you want to hear about Kennedy. I'm going to mention, and Garfield's buried in a wonderful tomb in Cleveland, Ohio, in Lakeview Cemetery. Even though it's called Lakeview Cemetery, it's about 5 miles from the lake. About the only place you can see the lake is from the top of Garfield's mausoleum. The coffins are in the basement, but it's the only mausoleum I've ever been in that has a ballroom on the 3rd floor. There's actually a full ballroom there. It's really weird. Okay, so we got William McKinley. who defeated the populist candidate William Jennings Bryan for the presidency in 1896 and 1900. Did I give you his past medical history? Vague history of weak heart. I'm not sure what that means. Nobody else does either. September 6, 1901, he's giving a speech at the opening of the Pan American Expedition in Buffalo, New York. Unknown to McKinley. Guess who else was visiting Buffalo, New York that day? Robert Todd Lincoln. You can't make this stuff up. Yeah. When the Lincoln Monument was dedicated in Washington, D.C. in 1909, Robert Todd Lincoln was still alive, and people had to do an incredible song and dance to get him to come to Washington, D.C. for the dedication of his father's memorial, because he was convinced that simply by being in Washington, D.C., President Taft would be assassinated. But that's where he's buried. He's buried at Arlington. He lived out his days in Manchester, New Hampshire, but then he's buried at Arlington. This is the Temple of Music. It's a beautiful building. I want to go through this rather quickly. An anarchist named Leon Chagath approached McKinley, shook his hand. He had his right hand wrapped in a handkerchief. That's because he had a weapon in the hand. So he shook McKinley's hand with his left hand and then walked behind him and turned around and shot him. So this is wrong. It's also wrong to make him look like Adolf Hitler. He really didn't look like Adolf Hitler. Also, there was an African American bodyguard on the scene. You will notice the way he's portrayed with the goggle eyes. This is obviously a contemporary from 1901. Although the Hitler I don't understand at all. Anyway, this is the weapon. It is on display in Buffalo at the Historical Museum in Buffalo. After McKinley was shot, he was taken from the Temple of Music here to the little hospital on the grounds. It was a little first aid hospital. And they actually did the surgery there. Now, what's interesting is he was taken in a motorized ambulance. This is 1901. That was driven by medical students. And this was actually staffed by the medical school in Buffalo at the time. This is the room where he was taken. And this is the guy who did the surgery. Now, the best surgeon in Buffalo at that time was Roswell Park. And that's who the big campus is named after now, is Roswell Park. But he was actually doing a procedure in Niagara Falls. So the second best surgeon, the one with the second most experience, was this guy, a gynecologist from Buffalo, Matthew Mann. Understand, a gynecologist from Buffalo is different from being a Buffalo gynecologist, right? Okay, so anyway, while he was doing the procedure, Roswell Park actually came back from what he was doing in Niagara Falls, and he approved everything that was done. I'm going to blow through this real rapidly. I want to show you where the wounds were. The first bullet actually sort of bounced off the sternum, and when they undressed him, this bullet fell out. The second bullet went through the stomach. And when they opened him, this is what they found. The bullet had gone through the stomach. It's 4 o'clock in the afternoon in upstate New York in September. Keep that data in mind, because that's important. That means, for one thing, he hadn't eaten anything for several hours, so his stomach was relatively empty. There was a little bit of fluid in there. He had not eaten dinner yet. They ran the bowel. They didn't see any holes in it. They oversewed the holes in the stomach, and they discussed whether they should put drains in, opted against drains, and they went ahead and closed him up. And everybody agreed that it went very well, except that, the operation was a success, but the patient died. And in 2 weeks, he became critically ill and lapsed into coma and died. And I think there is still some controversy about what the cause of death is. My own feeling is his maximum output post-op was 750 milliliters of fluid. That was max output. This is before they were doing IVs. They were doing Clysis. They were giving him lots of nutrient enemas, including oxgall, which is bile from a bull. I think what happened is he developed a hypokalemic dysrhythmia, and that's what killed him. Because there was really no sign of infection when they did the autopsy. I really don't want to go into too much detail on that because I know what you want to know about is this guy. Age 46, had a long and complicated medical history, including scarlet fever, chronic abdominal pain, influenza, anemia, hives, constipation, hematochezia, poorly healing wounds, agranulocytosis, allergies, asthma, chronic back pain, gastroenteritis, duodenal ulcer, jaundice, urethritis, and malaria. His surgical history is significant for tonsillectomy, adenoidectomy, appendectomy, and multiple back procedures. Did I leave anything out? Yeah, he had Addison's disease. He was on a political trip to Texas. He was actually in the medical literature in 1954. There's a case report of major surgery on patients with Addison's disease. If you dig that out, Kennedy was patient number 3 in that particular case report, or case series, I should say. He was visiting Dallas to try and drum up support for the 1964 elections. He was not very popular in Dallas at the time. There were wanted posters on the lampposts saying that he was a traitor to the United States. He was in Fort Worth in the morning. He gave a speech at Fort Worth. I love that picture. There's Connolly. There's Johnson. There's the hungover Secret Service agent down in front. And then they flew from Fort Worth to Dallas, which is very interesting because that's, 28 miles, something like that. They flew. But that's because it's easier to have a red carpet reception out of a plane than it is to have somebody just drive into town. So it was all for formality. And they flew his 1961 Lincoln Continental. They got off. There's the iconic pink pillbox hat and the pink suit that Jackie was wearing, and the roses. You'll see those roses again in a later photo. And then they went on a parade through the city. He was supposed to give a talk out at the merchandise mart. So they decided to drive through the city. These are some private photos that have surfaced over the last several years that people along the route took. I'm going to point out to you that Kennedy was 6'1" and Connolly was 6'4". And yet in this photo, you'll see that Connolly looks shorter than Kennedy. It's because of the way the seats were set up in this limousine. This is where they made the turn. They went past the school book depository, and the gunshots were fired. Then they went on. Parkland Hospital was actually on the way to the merchandise mart down the Stemmons Freeway, so they didn't really have to detour. They just stopped short. They went to Parkland Hospital instead of going all the way out. This is the Zapruder film. I want to point out a couple of things to you. Kennedy is waving when they go behind the sign. Watch where his hands are when they come out from behind the sign. His hands are at his throat. That's the first shot. Connolly's hit. You can see the expression on his face. The headshot is frame 312. Jackie leans over and bam. Okay? Now that's frame by frame. That's not the film running in real time. That's slowed down so you could get a better idea. That is the most studied piece of film in world history, I guarantee you. More people have studied that strip of film than any other strip of film, trying to figure out, have you seen the film? Have you ever seen the Zapruder film, and did you see what happened at that frame where everything spattered forward? Okay, so they head out to Parkland Hospital. This is just a bigger view of downtown Dallas. What surprises you when you visit this is how small Dealey Plaza actually is. In the films, it looks like a big place. Dealey Plaza is just barely a city block where all of this happened. This is where the shots came from. I'm not going to talk much about, I don't have time to talk about Oswald, but I want to talk about the medical care. This is Trauma Bay 1 at Parkland Memorial Hospital. When they arrived at the hospital, they took Connolly out first. And Connolly's care was assumed by one of the junior residents. I'll show you his name in a minute. This is the back seat of that limousine. You'll see the flowers tucked over in the corner. Some of the flowers, also the blood, the brain, all just scattered over the back seat. This is the faculty at Parkland Hospital, 1963-64. When Connolly was taken out, his care was assumed by this funny-looking dude named James Duke. Any thoughts who that is? That's Red Duke. Red Duke is still a trauma surgeon at Baylor. He was a junior resident at Parkland, and he was the guy who was in charge of the care of Connolly. Jim Carrico was an intern and actually the first to see Kennedy when he got brought into the trauma bay. And Carrico's the one who did the intubation. A first-year surgery resident did the intubation. And he was heard to say, "I was lucky to get the tube in. The trachea was almost severed." Now, Tom Shires was the chief of the department, but Shires was away in Galveston that day giving a talk. The title of the talk, you're going to love this. The preferred fluid for resuscitation in trauma, Ringer's lactate versus normal saline. That was 1963. Have we answered that question 48 years later? Nah. I think we're leaning more towards the Ringers now. So the guy that actually was in charge of the resuscitation was Malcolm Perry. Here's some of the other people who were involved. I'm not going to get into a lot of detail on this. When they intubated him for the old heads, remember these? The bird? Yeah, that was the ventilator that was used to ventilate him, was a bird. I'm sorry, that's a Bennett. That's a Bennett. The bird was green, right? That's a Bennett ventilator. Okay, Dr. Perry arrived. He noticed decreased breath sounds on the right and inserted a chest tube. It was about this time that one of the Secret Service agents leaned over and said, "Give him some cortisone." They actually sent a medical student to the pharmacy to get cortisone. And he brought it back, and then they wouldn't let him back in the room. And I've never met this guy personally, but I've met people who worked with him. And when he gets drunk, he tells the story about how he's standing outside the resuscitation bay, jumping up and down, yelling, "But I've got the president's cortisone!" And they finally let him in. Okay, these are the guys that were responsible. After attempted resuscitation, they did cut downs, they did uncross-matched blood, and after 30 minutes, they stopped resuscitation when they realized that half of the brain was gone. They realized they were not going to get him back. Now, Perry, in the meantime, because he was having such a hard time ventilating, decided to do a crike. And Perry said, "I didn't even wipe the blood off. I just wanted to get an airway." So he didn't realize when he was doing a crike that he was actually going through a bullet hole, or going very close to a bullet hole. And this came back to haunt him later. I also find it interesting that never once did they flip the patient, which is a mortal sin in a trauma. You've got to flip the patient. You've got to look at the back. But they never did that. For people who are conspiracy theorists about all the early deaths associated with this, I point out that Carrico died in 2002. Tom Shires died about 2 or 3 years ago. Malcolm Perry is back at... No, Malcolm died last year. He died last year, but he went back to Southwestern after a career at Columbia, and Red Duke is still at Herman Hospital in Houston. So all these guys lived long lives. Nuts. I am almost out of time. I want to show you the first. This is the track of the first bullet. First of all, you have to understand, people don't want to give Lee Harvey Oswald credit. They say he wasn't that good of a shot. They're right, he wasn't that good of a shot. He only hit his target 1 out of 3 times. His target was the back of the president's head. He only hit that 1 out of 3. He had no idea where the first 2 bullets went, except he knew he hadn't hit his target. He didn't realize that one of the bullets had actually gone through the neck like this. When it went through the neck, it's possible that it bruised the spinal cord. And what you're seeing when Kennedy comes out from behind the sign, remember when he goes behind the sign, his hand is up and he's waving? And when he comes out from behind the sign, his hands are up like this? That's the Thorburn reflex from a C5, C6 spinal cord injury. There's his hands up at his neck. The bullet hole in the shirt has been a matter of contention because it's kind of high on the shirt, as is the bullet hole in the jacket. And people say, no, that must mean it's an exit wound and the shot came from the front. But I want to point out to you that when he was going behind the sign, his hand was up and he was waving. What does my jacket do when my hand is up and waving? It's riding up. So that's why the bullet hole is so high. I don't want to go into a lot of details. Yes, the single bullet theory actually works. There really was just a single bullet who got both Kennedy and Connally. This was a recreation by the FBI the next spring. And a lot of people say, well, how could Oswald have possibly shot through all of those leaves in the tree? Hello, it was in November. There were no leaves on the tree. He had a clear shot. It was in the recreation that there were leaves on the tree. And this is the kill shot. This is the headshot. 3 pieces of skull were actually found on the street of Dallas and flown in a separate plane to Washington, D.C., where the autopsy was done. The autopsy was done at Bethesda, which made a lot of people ask questions also, because normally it would have been done at the Armed Forces Institute of Pathology at Walter Reed. But Kennedy was a Navy man, remember, and his family insisted that it be done at a Navy hospital by Navy doctors. And they got their wish, and that's why it was done at Bethesda. The reason Kennedy couldn't fall over after the first shot is because he had this back brace on. He had awful back problems, and he wore a back brace all the time. And after the first shot, even if he was paralyzed, he couldn't have fallen over because the back brace kept him held up. Now, why did his head go back and to the left? And I'm going to stop after that. There are 3 reasons I can give you why his head went back and to the left. The first is the jet backwash effect. Small hole in the front, back, big hole in the front. It throws the head back. This has been demonstrated on many different experiments. A guy named John Latimer in New York City took a skull, filled it with plaster of Paris, set it on a ladder, shot it with exactly the same type of rifle. The skull flew back. Penn and Teller did the same thing with a cantaloupe wrapped in duct tape. They shot it with a high-power rifle. The cantaloupe flew back. Penn and Teller suggested you not put another little cantaloupe with a pink pillbox hat on top of it. That would be in bad taste. So the jet backwash effect is one thing. Secondly, what happens to our seizure patients when they have an acute insult to the brain? What's the first position they take? It's the tonus. They go into full extension. He's had the ultimate insult to the brain, getting shot in the back of the head, and he went into tonus from that. Now, for that to work, you have to believe the spinal cord is still intact, right? So that's part of a spinal reflex. And then the third thing is the righting reflex. If you were to reach up and smack the back of the head of the person in front of you, the head would automatically come back to an upright position with a little overcompensation. That's just a reflex. Don't do it. Please don't do it. So that's a third reason. And again, you have to have the spinal cord intact for that to work. But the jet backwash effect should be enough to explain this. Could Kennedy have been saved with contemporary medicine? No. Absolutely no way. Half of his brain was blown away. I'm not even sure he would have been a good organ donor once they found out about the Addison's disease, the daily shots of cortisone, and all the other medical problems that he had. So I'm going to stop there, and I've already gone over by a few minutes. I hope that's given you a little bit about one of my passions, which is medical history. I wanted to show you how the care of people has changed over the last 100-year period between 1865 and 1963, and how we've sort of carried forward from that over the last 45 years or so, and how we don't always do the best thing. A couple of these people were victims of the VIP syndrome and probably would have done just fine if their doctors had left them alone. So thanks for your attention, and I'm going to be outside if you have any questions.